So lupus is an autoimmune disease. What that means is that our body has an immune system that is supposed to protect the body from diseases and infections and things like that. In order to do that, the immune system will produce antibodies. In lupus, the immune system loses the ability to tell the difference between what is disease and what is not, what is infection and what is not. And so what happens is that the immune system will cause the antibodies to start attacking tissue and muscle and organs and things like that. So persons with lupus will suffer the effects of that attack of the immune system on the various organs.
Sometimes it's not easy to diagnose lupus because the signs and symptoms can be quite insidious. It means that they can be really difficult to find in some cases, and it takes a level of suspicion for a physician to start thinking of lupus in a person. But the signs and symptoms that we know are things like pain in the joints, especially the small joints of the hands and the feet. For some strange reason, at least in my own experience, it tends to happen to young girls more than it does to young men or young boys, and it's most higher in the female population, at least from the Grenada standpoint.
There are three primary types. There's one that affects the skin only, that's known as discoid lupus, and then there is one that attacks the entire system, that's referred to as SLE. That one is a little more challenging to deal with because, as I said, it will affect various parts, the entire system, various parts of the body. And then there's a type called drug-induced lupus, where a person may be put on a series of medication that may cause them to present with the symptoms of lupus. But once the medication stops, once that process stops, you find that the symptoms go away.
I was diagnosed with systematic lupus erythematosus at the age of 15, also known as SLE. I've been living with it for 5 years now. I've endured multiple hospital visits, routine lab tests, doctor visits, excruciating pain, blood transfusions, traumatic surgeries, psychological breakdowns, allergies, anxiety, depression, to kidney failure and dialysis.
I was diagnosed in 1996, so this year would be 21 years. But I started with my symptoms quite a bit before that. I actually started with my symptoms when I was still in secondary school. I was 17. So it took almost 5 years for them to really come up with the diagnosis of lupus.
Given what I have endured, I know for sure I could not have done it alone. I know that it was not only the work of man, but the hand of God as well. I've literally stared death straight in the face, and I've lived to share my story. Chronic illnesses like lupus can undeniably incapacitate one's ability to have an actively social life. However, in lieu of that, I have made new friends and strengthened existing friendships built solely from love, concern, a caring heart, and empathy.
Lupus is such an unpredictable disease. You can feel really, really good one day, and then you go to sleep, and then the next morning you can't get up. So it's difficult to make long-term plans. And so having that support is amazing because it means that if for some reason there's something that's planned and I have to change, people understand.
My mantra has always been, how do we prevent things? And I wish I had the magic wand as to say what we can do to prevent lupus. However, that's a bit more tricky because there's a strong genetic predisposition to it. In other words, people are born with a predisposition to having lupus. And so if you're a person with a genetic predisposition and you're going to get lupus, there's nothing much I can do to stop you from getting it. But what I can say is we are aware of what are the foods that are used to boost one's immune system. So we're talking about the bright colored foods, yellow, green, orange, red. So your pumpkins and carrots and bananas and oranges and pawpaw. Those bright colored foods are the foods that really boost our immune system so that we really can function well.
I just want to let persons who have lupus or any other condition to know that it is not a death sentence. You just have to take it easy, one day at a time. Do not exert yourself. Manage yourself properly. Follow your dietary guidelines. And most importantly, know for sure that life is a gift, that life is precious. And no matter how hard it may seem, giving up should never be an option.